Welcome to Health Code Blueprint. Today, we're focusing on ICD 10-cm coding guidelines to support proper code selection for Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue, covering codes M00 through M99. In this session, we'll walk through the site and laterality rules, clarify what counts as a single versus multiple site condition, break down how to distinguish acute trauma from chronic or recurrent conditions, and talk about what active treatment really means when assigning seventh characters. Disclosure. This presentation is intended for educational purposes only. It does not constitute legal, compliance, or billing advice. Always refer to official coding guidelines, organizational policies, and regulatory requirements when making coding decisions. Chapter 13 coding really comes down to three variables. Where is the condition? When did it occur? And why did it happen? These three questions, site, timeline, and etiology, drive every coding decision in this chapter. Laterality identifies whether the condition affects the right, left, or bilateral side. Site identifies the exact bone, joint, or muscle involved. In Chapter 13, specificity is everything. Most codes require you to identify the exact anatomical structure and the side of the body. General terms like shoulder pain or leg pain aren't enough. Precise site and laterality ensure accurate and clinical clarity. A bone condition affects the osseous structure, while a joint condition affects the articular space. Just because a condition is near a joint doesn't mean it's a joint condition. Avascular necrosis, for example, affects the end of the bone, not the joint space, so it codes to bone. Osteoporosis also affects bone integrity, even when symptoms are felt around a joint. Always ask, is the pathology in the bone or in the joint? When documentation lists specific sites, like right knee and left ankle, you assign separate codes for each site. The multiple sites option is only used when the provider doesn't specify which sites are involved. It's a fallback, not a shortcut. Acute trauma refers to a sudden injury event, something that happens right now, in the moment. Chronic conditions, on the other hand, develop gradually over time or show up as the long-term effects of a previous, healed injury. So here's the rule in coding terms. If the patient is experiencing a current, active injury, that takes you straight to Chapter 19. We'll dive deeper into those guidelines later in our coding series. But if the patient is dealing with the after effects of a past injury, things like chronic pain, stiffness, or deformity, that belongs in Chapter 13. The key is always determining whether you're looking at a brand new event or the lingering result of something that happened in the past. When a patient presents with pain at a previous injury site, you need to determine whether this is a new injury or a recurrence. If it's a new event, code to Chapter 19. If it's a chronic or recurrent issue, code to Chapter 13. And if the documentation is unclear, you stop and query. No guessing. A pathologic fracture is a break in a bone that has been weakened by an underlying disease, such as osteoporosis or cancer, rather than by trauma. These fractures use a seventh character to indicate the phase of care. Character A is assigned when the patient is receiving active treatment, character D is used during the routine healing phase, and additional characters are used to report complications such as malunion or non-union. Understanding this full life cycle is essential for accurate coding. Active treatment is determined by what's happening clinically, not by whether the provider is seeing the patient for the first time. If the patient is in the ER, undergoing surgery, or receiving active management for the fracture, you assign seventh character, A. But if the visit is for a cast change, routine follow-up, or pain management, that's not considered active treatment. At that point, the fracture is already healing, and the patient may simply be experiencing expected symptoms, like pain, or may need a cast change because it became cracked or wet. Remember, active treatment must be directed at managing the fracture itself. Routine healing refers to the normal recovery phase that follows the completion of active treatment. Once the acute phase has passed, the patient transitions into routine healing, and that's when you assign seventh character, D. This phase includes things like cast removal, follow-up X-rays to check healing progress, and medication adjustments. But if the healing process isn't progressing normally, for example, if there's malunion or non-union, you no longer use D. Instead, you assign the appropriate complication code. Systemic osteoporosis affects all bones and does not require a site-specific code. Osteoporosis with fracture requires identifying the exact fracture site. M81 is used when the patient has osteoporosis without a current fracture. Because the disease is systemic, you don't code a site. But M80 is used when the patient has osteoporosis with a current pathologic fracture, and here, the site must be identified. When a patient has osteoporosis without a current fracture but does have a history of previous fractures, you assign M81 along with the history code Z87.310. This combination reflects the patient's ongoing risk and acknowledges the long-term impact of those prior fragility fractures. Category M80 is used when a patient has osteoporosis with a current pathologic fracture. This is considered an acute event because the fracture is happening right now, during this encounter. The key point is that the fracture occurs because the bone is already weakened by osteoporosis, not because of significant trauma. Even a minor fall or low-impact incident can cause a break when bone strength is compromised. Under M80, you must identify the specific fracture site, and then assign the appropriate seventh character to show the phase of care, whether the patient is receiving active treatment, is in routine healing, or is experiencing a complication such as malunion or non-union. Recognizing that the fracture is directly related to osteoporosis, and not a traumatic injury, is essential for selecting the correct code in this category. When a patient with osteoporosis experiences a fracture after a minor fall or low-impact event, the key question is whether that level of trauma would normally break a healthy bone. If the answer is no, then the fracture is considered pathologic, and you code it to M80 rather than using a traumatic fracture code. In these situations, the underlying bone disease is the primary reason the bone failed, so the osteoporosis with current pathological fracture code takes priority. This approach ensures the coding accurately reflects the patient's true clinical picture. To summarize, use specific site and laterality whenever the documentation allows. Assign separate codes for each individual site that's clearly identified. Remember that acute injuries belong in Chapter 19, while chronic issues or conditions resulting from healed injuries fall under Chapter 13. Active treatment is determined by the phase of care, not by which provider is seeing the patient. And for osteoporosis, coding depends on whether a current fracture is present. Thanks for watching Health Code Blueprint. See you in the next video.